Welcome to our immersive VR experience. Today we are diving into a critical medical procedure, thoracentesis. This VR tutorial will give you a unique, hands-on perspective from the point of view of the person actually performing the procedure. Dr. Brian Buchanan will guide you through each step of the thoracentesis from preparation to completion, ensuring you understand the key techniques and important safety measures. Remember, practice makes perfect, and this VR experience is designed to help you master the art of the thoracentesis. If you're ready, then let's go.
Okay, so first we're going to landmark the area, okay, and to landmark the area we image first with we're going to use a curvilinear probe, okay. It's got a really nice depth, okay, and will offer us pretty good resolution in the lower thorax. So we're going to apply the curvilinear probe first to landmark our area to make sure it's the appropriate entry site for thoracentesis or a subsequent chest tube. Okay, so let's apply the curvilinear probe. Okay, we're going to apply with a marker towards the head. We are in the conventional radiological position on ultrasound with the screen marker right. And here we can see that there is the diaphragm, the lung, and again, screen marker right. Depth, we're 16 centimeters. So this looks like a favorable entry site. Okay, nice big anechoic space. But let's move the probe now 90 degrees, marker towards the ceiling. Okay. Yeah, marker towards ceiling, that's good. And let's just make sure that on both axes we have enough space. Let's go a little more superior. There we go. That's a nice anechoic space. Okay, so we have a good distance there, at least 4 centimeters for needle entry. That's very safe. Let's mark this area with the blunt fill cannula. Okay, again, just the blunt end, and we're going to mark there in advance. Okay, this is more of a static guidance technique where we mark in advance. Then we're going to prep and drape the area. Okay, so once we're happy with this, we're not going to change positions. Okay. The next thing after this probe's applied and we're satisfied with the position is we're going to apply the actual linear probe to make sure there's no vessels in the area. So let's swap out probes. And we're going to look for blood vessels. So we're going to apply the probe with the probe marker towards the head, okay, and we're going to look across the vascular space and look for any obvious blood vessels in this area, okay. Generally in this area, the neurovascular bundle, okay, the arteries and veins in the intercausal space, will be below the rib. So we aim above the rib to prevent inadvertent puncture. Okay, so thinking about if the marker is towards the head, okay, then it's going to be under. So there could be some space there. We can put some color on that space. Okay, and we can look for any obvious vessels that are in the middle of the screen. Okay, so generally the vessels will be right below the rib. Okay, this is color. We can even put on some color power Doppler there. We can see the vessel, okay, under the superior aspect of the rib. Okay, so we want to aim at the overlying rib and go over the rib to avoid penetrating the neurovascular bundle. So now that we're happy with the space, okay, we're going to go ahead and we're going to prep the skin and drape the patient and then start with the procedure from there. And we'll introduce all the instruments. Okay, so you have now prepped and draped the patient. So this is how we prepare and drape in the intensive care unit. If you're in a clinic, you might drape differently, maybe with a limited, either green towels or a paper drape, for example. But here we're taking kind of full sterile precautions. So the area has been prepared with a chlorhexidine solution. We've draped the area now. Okay, we're making sure we have all our tools, okay? And thinking about this from a procedural stepwise fashion, the first thing we'll do is make sure we have all our instruments, okay? So we have our syringe for injecting local anesthetic. We have our small, 23 or 25 gauge needle to enter the skin. We also have our scalpel, and we have our thoracentesis kind of catheter over needle in the white right there. And we have our ultrasound probe draped. We have landmarked the area already. However, it's good to prepare this probe just in case you're experiencing some difficulties. Okay, and then depending on how you plan to collect the drainage, you might have tubing to a Foley bag, or if you were leaving the drain in place, you'd collect that to a chest tube. Okay, so the next step from here, step one, is to basically We've landmarked the area beforehand with static guidance. Let's freeze the periosteum of the rib, or the skin, and then the periosteum, and get down to the pleural space and make sure we're happy with our trajectory. Okay, you may now proceed. Excellent, so we'll make a little bleb in the skin and just freeze. Perfect. So at this point, you can change to a longer needle, okay, so a longer needle to get down to the rib periosteum and to the pleural space. So we will switch to a longer needle, and normally it's also a bigger gauge as well, so this is probably a 22 gauge. Now we'll aim directly for the rib, okay, so we aim for the periosteum, we freeze the periosteum, and then we pass just slightly over the rib. Okay, and let's see if we can find a nice trajectory. Can you pass it all the way to the pleural space? Yes, yeah. So if you hit the rib, just go over. Hit the rib, go over, and just keep aspirating with your other hand to make sure you are satisfied with your approach. Because that is the key here. Okay, aspirate continuously as well. Okay, keep going. Okay, keep going. Yeah. So you may have to, the skin, you may have to actually kind of enter more this way. Okay, because I think you're kind of going to the side. So the chest wall is here, then your needle should be more like that.
So when I hit the rib,
yeah,
I go travel upwards?
Yep. So this is the rib here.
Yeah.
Needle hits, you just walk upwards.
Okay.
Okay. So yes, here we'll aim for the rib, and then we're going to simultaneously freeze and aspirate. Okay, and once we pass into the pleural space, you should get a nice aspirate. There we go. Okay, keep going. Yeah, you got some fluid back. That's nice, nice and clear actually. So that's your trajectory that you'll follow with your bigger needle. Okay, so from here the needle will come out and you'll put some gauze over the area. So that's a nice trajectory. So keep that in mind. So now we're going to make a small nick in the skin just to pass our catheter over needle assembly. Yep. Okay, now we're going to connect the actual syringe. Okay, so let's just connect that. Okay, and we can empty the contents into one of our... Okay, perfect. Now the key thing here is to have your right hand on the back near the syringe and the left hand in advance near the skin, okay? And keeping in mind our trajectory. So again, the whole point of this is to have one hand stabilize the needle and one hand stabilize the syringe in the back and one hand stabilize the catheter needle assembly in the front. So we're going to pass it through our area where we made the incision, okay, aim for the rib and then go over. And we're going to simultaneously aspirate as we pass this catheter. Okay, perfect. It's passing well.
Not entirely.
So again, the key thing here is to aim for the rib and then just go below. Oh, sorry, above the rib, sorry. Aim for the rib and go above the rib. Is it getting caught on the skin?
Yeah, I think so.
Okay, I think you are getting caught in the skin, so you need to make a bigger incision in the skin. That's your issue, yeah, you can kind of see actually. So make sure incision here is big enough that you can fit the catheter. Okay. You may want to just take some gauze and just dry the area off. Make sure you can see the wound. Yep. Perfect. A big mistake here would be to make it too small, and that way you can't pass the catheter.
Feeling the rib going up.
Okay, feeling the rib and then passing over. Okay. Okay, can you pass the catheter?
Through here. No.
So yeah, use both hands to pass. Yeah, it looks like you're in the space. Okay, so okay, yeah, just a little bit harder, I think, with your left hand to get it in there. Okay, so hold it with both hands together and kind of push in as one. There you go.
Yeah.
There you go. So you nice feel a little bit of a release. Now your right hand can pass the catheter your left hand can pass the catheter while the right hand stabilizes the introducer. Okay, go ahead and pass the catheter now. Okay, it'll slide off the back. Exactly. It'll slide off right there.
So go.
Yep,
Pass it off.
you bet. Yeah, and move it in the skin as you're going. Like you want to make sure the catheter goes in the skin, if that makes sense, right? Yeah, perfect. Okay, now pass that catheter. Yeah. Remember, keep passing that catheter as you go. Perfect. Exactly. That's great. Okay, now that the rear assembly can come out with the syringe. Perfect. That can come out. That is now a sharp. So make sure you discard of that safely there. Yep, that can go on the side. Okay, now we have the Thora device in place. Now let's get a sample. So let's take the 50 ml syringe. Okay, and you're going to enter the side port. Yep. And then that stopcock, okay, that's going to have to turn outward. That's off. Okay, so if you turn it outwards,
This way.
yeah, towards you. Now let's get a sample. So draw back. There we go. Nice and clear. That's a very nice sample, okay? So this is where we're going to send for analysis on this particular device. Perfect. Okay, let's change the stopcock. So you turn that off and disconnect, and we can send this for sample. We can either inoculate culture bottles at the bedside, which I'd recommend, both aerobic and anaerobic, and then send off for the rest of your kind of lights criteria labs. Okay, and then from here, if this was just a thoracentesis, we would disconnect, okay, and we take this and we'd pull it out, apply a Band-Aid, and then potentially get an X-ray post, okay? But this is largely the procedure. We have not sutured this in, okay, so it's not secured, and this will really be for temporary purposes. So from here, and we could also connect some tubing and assembly to a Foley bag if we wanted to do a drainage procedure for thoracentesis here.